And then here again with the U facing forward in front of her. Out towards now. Very good. So air is greater than bone conduction in that test. The acoustic test is cranial nerve is normal. So now we're going to go into the glossopharyngeal. And I have my turn weight. I'm not actually going to touch with this, okay? So I am going to have you, I'm listening to her speech first of all. Can you swallow for me? Very good. Open your mouth. Say ah, ah. So I may even use my pen light and look back, and I'm looking at her uvula and her soft palate to see if they rise symmetrically. If she has an abnormality, if she has an injury to the brain, if the uvula or the soft palate deviates to that side, that's the side of the injury. So now I'm going to, and then she says ah, so I'm listening to that as well. And then I'm going to have you stick your tongue out and move side to side. And I'm testing her for symmetry. If her tongue deviated to one side, that would be the side of the injury. Now we're going, oh, I forgot this one, the last one, the accessory nerve. So I'm going to have you push up against my hands, and I'm pushing down, and then I'm going to have you push against my hand here and test the sternocleidomastoid and the trapezius muscles there. And then I'm not going to actually do this because, again, we don't normally do this in the office, but the gag reflex. So it would just be, you would really only, you do this to patients that are intubated, like you can tell, you're kind of testing it when you're intubating them until you see a gag reflex. But I would just lightly place this in the back of her pharynx, and you would see a gag reflex. Okay, so now we're going to go into strength. So I'm going to test your arms and your legs. I'm going to have you go like this. We're testing her biceps at C5, C6. I'm going to ask you to just pull in. Don't let me pull you. Don't let me pull you. Okay, now push away. Bring your wrist like this. Now push away. Hard, hard, hard. Do one at a time. And then this one. Okay, and I'm comparing her strength. That's the triceps at C6, 7, 8. And then we're going to do wrist extension. So I'm going to have you turn your hands up. And then I'm going to try to push them down. Don't let me push them down. Don't let me push them down. Very good. So that's again C6, 7, 8. Then I'm going to have you straighten your arms out and spread them really far. Don't let me push them in. Don't let me push them in. Don't let me push them. This is testing for the ulnar nerve at C8 and T1. And then I'm going to have you put your thumb like this. And this is C8 and T1 at the median nerve, and push again. Now grip my fingers tight as you can, tight, tight, tight. Good. Okay, and that's C7, C8. And so now we're going to move on to your legs. I'm going to have you push your legs up against my resistance, okay? Push hard, hard, hard. Good. And hard, hard, hard. Good. So that's hip flexion at L2, L3, L4. And then I'm going to bring my legs under my hand underneath me. Now push down as hard as you can. Okay, good. And push down as hard as you can here. And that's hip extension. So that's going to be at S1, testing for S1. And then I'm going to have you push hard here against me. Hard, hard, hard. Hard here against me. L2, L3, L4. For knee extension, and then for knee flexion, pull as hard as you can inward. Pull as hard as you can inward. Very good. And that's testing for L4, L5, S1, S2. Then I'm going to have you dorsiflex. I'm going to have you bring your toes up to the ceiling, and I'm going to try to press them. Don't let me press. Don't let me press. Don't let me press. Don't let me press. Very good. That's testing for L4, L5. And now push down on me here, and push down on me here. Very good. And that's testing for S1. So, okay, now we're going to go into our coordination movements. And I'm always checking my patient to make sure that she's comfortable. We're going to do rapid alternating hand movements. There's two ways that you can do this. You can go like this, if you will do this, or you can do like this, if you'll do like this with me. Okay, very good. So now I'm going to hold my finger up. I want you to touch your nose and then touch my finger, okay? Touch your nose and then touch my finger and then touch your nose and then touch my finger and then touch your nose and then touch my finger. Okay, now I want you to raise your hands up in the air. Okay, and I want you to keep your eyes open. With one finger, I want you to touch my finger. Come down. Okay, and then the other one. Now close your eyes and do the same thing. Good. And again. Very good, very good. Okay, so that's testing for some of our coordination. Now the other one that we often do, especially if there's a spinal cord injury or tumor, is I'm going to have you bring your ankle to your shin and come up really slow and down, and then the other side, and then with the other foot. Very good. Okay, and another thing that they can do that we test for is even if they're sitting, you can ask them to move their toes into different directions for coordination also.